Good afternoon. Thank you for joining us today for this webinar, Assessing Your Local Wellness Policy, What You Need to Know and Why. This webinar is being recorded and the recording will be shared after the webinar has ended. If you have any questions throughout the webinar, please enter them in the Q&A and we will answer as many questions as possible once the presentation portion of the webinar has ended. My name is Jennifer Goodwin and I am the lead for the school nutrition programs at the Rhode Island Department of Education. And I will be joined today by Karin Weatherall of the Rhode Island Healthy Schools Coalition, who is going to share some valuable information and resources for assessing your local wellness policy. We also have Caitlin Mandel with us here today, and she's going to help navigate the Q&A at the end of the presentation. First, though, I'm going to give you a little background on local wellness policy requirements. The National School Lunch Program federal regulations require all local education agencies, or LEAs, participating in the National School Lunch Program to establish and maintain a local wellness policy. In addition to outlining minimum contents that must be included in the policy and requirements for public involvement and notification, the regulations also require that the policy be assessed at least once every 3 years and that the assessment be used to consider updates to the policy. Our job here in the Office of School Health and Wellness at RIDE is to ensure that LEAs are adhering to all of the federal program regulations, including the wellness policy requirements. We achieve this oversight by conducting an administrative review, or audit, at each LEA once every 5 years. Currently, RIDE is contracting with a third-party company to conduct the administrative reviews, but that company still reviews all of the same aspects of the program that we do and also has access to the resources we are sharing with you today and can provide them to you as technical assistance. RIDE also contracts with the Rhode Island Healthy Schools Coalition to provide targeted technical assistance on wellness policies, including policy contents and assessments. The coalition has been an invaluable partner providing trainings, holding workshops, attending wellness policy meetings, and maintaining a wealth of resources on their website for LEAs to access at any time. And with that said, please welcome Karin Weatherall to present on wellness policy assessments.
Thank you, Jen. I am pleased to be here this afternoon and to provide local wellness policy assessment training in partnership with you and the rest of the RIDE Child Nutrition team. I'm Karin Weatherall, and I am the co-director of Rhode Island Healthy Schools Coalition. Our goals for this webinar are 1, to review the use of the local wellness policy assessment tools, which will help you prepare for the triennial assessment requirement and help you better understand how a strong wellness policy and its implementation can benefit your students, staff, and families. And 2, to familiarize you with the Rhode Island Healthy Schools Coalition website so you can easily access our resources and tools. Rhode Island Healthy Schools Coalition has partnered with RIDE to provide guidance and support for school wellness for over 15 years. Our mission is to make all Rhode Island schools healthy places for children to learn, grow, and thrive. Our work is grounded in a whole school, whole community, whole child framework, known as WISC, that recognizes the critical roles of both school and community in meeting the needs of children, health, and academic. We work at the school, state, and national levels to provide support to Rhode Island's school wellness priorities. We support local wellness policy work in schools and districts by involvement in wellness committee activity, by providing technical assistance for policy development, revision, and assessment work, and by offering resources and connections with community organizations, state agencies, and national partners for implementation. Let's start by getting acquainted with the RIHSC website. The simple menu you see on the top of the homepage will help you navigate. We're going to focus on 2 sections of the website for today: the Wellness Policy tab and the Wellness Topics tab. The Wellness Topics tab has a drop-down menu with sections for many areas of school health and wellness. Each of the content headings links to a page of resources, research, data, and more from Rhode Island and national partners. These can be enormously helpful to review when setting wellness priorities or seeking evidence-based resources for your schools and districts. Here's the health education page. It covers the national and Rhode Island health education standards, the Rhode Island curriculum framework, and the 8 health skills. Like other content pages, an accordion folder organizes links to resources, in this case, to lesson plans and teaching guides. The Wellness Policy tab also has a drop-down menu with wellness policy guidance and Rhode Island wellness policies by district. Here you can find links to all Rhode Island's 36 public school districts and many charter and independent school wellness policies. The Wellness Policy Guidance heading links to detailed information on how to develop, how to implement, and how to assess local wellness policies in schools. Here's the Wellness Policy Guidance landing page. We've subdivided the information to make it easier to find what you need. You'll notice a link to Rhode Island General Law 1621-28, passed in 2005 by the Rhode Island General Assembly, which establishes the requirements for Rhode Island school health and wellness committees, and a link to a wellness committee toolkit. This was recently developed by RIDE and RIHSC and includes the who, what, where, why, and how of establishing and maintaining a successful wellness committee. This is a great resource for any new wellness committee leader or member. It is linked here and on the 10 steps for a wellness policy page. The first tab, What is a Wellness Policy?, links to a page summarizing the history of the federal school wellness policy requirement and outlining the minimum policy requirements stipulated by the Healthy, Hunger-Free Kids Act of 2010, including specific content goals, language on public involvement, policy implementation, and assessment. Remember, these are minimum federal requirements, but a local wellness policy can and should go beyond these requirements and be customized to reflect the unique needs of a school community. Additional provisions can be added to address other areas such as farm to school, outdoor learning, food insecurity and food safety, teacher training, and mental and social emotional health supports. Policy is important because it demonstrates the commitment of a school or district and helps to ensure sustainability. The next tab, 10 Steps for a Wellness Policy, links to a page outlining the school wellness policy process. There are 10 recommended steps with guidance, resources, and templates offered for each one. For today, we're going to focus on the 2 steps that address assessment. Step 1, assess, revise current policy. And Step 9, monitor and assess implementation. Assessment of a new or revised written policy is the first step in the process. The policy should guide the district's efforts to establish a school environment that promotes student health, well-being, and ability to learn. All federal and state requirements should be included, as well as evidence-based practices and goals as they apply to your school community. The Rudd Center for Food Policy and Health has an assessment tool for written wellness policies, the WellSat, which is widely used by schools nationwide. Originally developed in 2006 by a team of researchers, it has been updated multiple times with input from partners around the country to reflect the changing policy landscape and best practices in school health. The assessment scores written policies on 65 items for both comprehensiveness and strength of language. In 2025, a new WellSat website platform was designed, and this assessment tool was renamed the WellSat Policy. The WellSat Policy is helpful for crafting and revising comprehensive, strong, and clear policies that comply with federal Healthy, Hunger-Free Kids Act requirements and evidence-based practices. Many Rhode Island districts, and probably many of you on this webinar, are familiar with the WellSat survey and scorecard. The new platform and the revised WellSat policy assessment are easy to use. A short instructional video is included on the website, shown here, for anyone new to the WellSat or those needing a refresher. And of course, RIHSC is always available to provide technical assistance to anyone on a wellness team working on a policy assessment. Let's now move to step 9 of the policy process outline, which includes assessing actual practices in your school or district. Your written policy may meet all of the requirements and reflect your local community's wellness goals, but how is it being implemented in your school or schools? Tracking quantitative data and reviewing qualitative input will provide details about what's working, what can be replicated and sustained, and what needs better communication or attention for improvement. An implementation assessment tool is essential for ensuring compliance with laws and regulations, reviewing how your schools are implementing specific practices, complying with the triennial assessment's public reporting, and being prepared for a USDA administrative review. There are 2 assessment tools available for use. The Rhode Island Healthy School Coalition Policy Compliance Assessment is an implementation checklist for individual schools and a companion district summary. The standards of the checklists are adapted from USDA requirements, Rhode Island laws and regulations, and national model policy language and evidence-based practices. The Rudd Center's WellSat Practice is a new implementation assessment tool to be used with the WellSat policy available on their new platform. It also includes standards adapted from USDA requirements and national model policy language, but it does not include Rhode Island laws and regulations or allow for implementation assessment at individual schools, only a district review. It's nearly impossible to track adherence to policy without understanding individual school practices. Schools have unique staff, programs, schedules, culture, and communication styles, so a school-by-school assessment is advantageous for a district. If you'd like to learn more about the Rudd Center's practice assessment, you can refer to the About button on the WellSat website. Both of these assessment tools are linked from the RIHSC Monitor and Assess webpage. For this training, I'm going to focus on the RIHSC Wellness Policy Compliance Assessment. As I mentioned, it's made up of a single school checklist and a district summary checklist. Both have been designed to be used digitally in Google Sheets, and both include the pertinent federal and state legal references. This is the single school checklist. It's important to read the instructions on this cover page first. You'll need to make a copy of the spreadsheet and save it to your own Google Drive, as the files are view only. We also recommend a team approach for completing the checklist, where individuals most knowledgeable, such as nurses, food service staff, PE health teachers, and even PTO leaders at the individual schools are included. The checklist has 9 tabs at the bottom of the spreadsheet. There is a cover page tab, seen here, for basic information, 7 content tabs, each pertaining to sections of policy, and a next step tab. This is an example of one of the 7 policy content tabs, nutrition education. Each policy section contains related policy standards with a notation if it's a federal or Rhode Island requirement. As example, the federal and state statutes prohibiting marketing of foods and beverages that do not comply with USDA nutrition standards during the school day is noted here in this section. The policy standards are scored with a simple rubric using the measurement codes ES exceeds standard, MS meets standard, NI needs improvement, or NA not applicable. Each person who is completing any part of a section should initial that and include any relevant notes. This is the Next Steps tab, which includes grand total scores that get automatically transferred from each of the 7 policy content tabs. Here, there's also a space to list areas of compliance and success and areas in need of improvement, as well as a note section for goal setting and planning. This quantitative and qualitative data summary offers a good snapshot view of a single school's wellness policy implementation. Now let's look at the district summary checklist. It is used to assess policy standards related to district leadership and wellness committee functioning, and to summarize results from the single school checklist. The district summary allows for easy review and interpretation of data for the district as a whole. As with the single school checklists, the first thing to do is make a copy and save it to your own Google Drive. The district summary looks identical to the single school checklist with the same 9 tabs, but it includes an additional tab for district standards. This section, shown here, should be completed by someone knowledgeable about the Wellness Committee and policy, such as a co-chair of the committee or someone in central administration. Once the District Standards tab is completed, the data from each of the single school checklists needs to be added to the district summary. Shown here is the Communications tab. It is the first Content Standards tab following the District Standards tab, and it is here where individual school names should be added to the top of the page. These school names will automatically transfer to all the other tabs. The measurement codes for all standards of each single school checklist need to be transferred to the district summary from the drop-down menu in each cell. Now, as you can see, the grand totals also appear on the Next Steps tab with this district summary, and the data is represented as numerical totals and percentages. So this page is a great picture of the entire district. There's also a section here to list district successes and action steps that the district can take to complement the action steps at individual schools. These implementation assessment spreadsheets may feel a bit complicated and confusing, but we have a step-by-step tutorial video linked on the Monitor and Assess webpage. It can be viewed and easily paused as needed by anyone preparing to complete a section of the assessment. RIHSC can also assist with its completion and data transfers, so just ask as needed. We generally recommend that the Wellness Committee take the lead for completing the assessments as part of a triennial review. To organize and simplify the process, single school checklists can be saved and labeled for each school in a Google folder. These can then be shared with school principals who are responsible for completion of their single school checklist, but who can identify those best able to contribute to each section. Once all single school checklists are complete, the district summary can be completed by a Wellness Committee co-chair, member, or central administrator. The checklist data, both quantitative and qualitative, for individual schools and the district as a whole, can inform the Wellness Committee's efforts to provide additional support, share best practices, and establish new goals. They can also be used to comply with the public reporting requirement of the triennial assessment, either presented as part of a report at a school committee meeting or posted on the district website. A wellness policy implementation report is also valuable for substantiating wellness policy compliance for the USDA administrative review done by RIDE. As Jennifer Goodwin mentioned at the beginning of the webinar, the administrative review is a comprehensive evaluation process conducted by state agencies, in our case RIDE, on behalf of the USDA, to assess how participating school food authorities are complying with federal regulations. In addition to reviewing the program's finances, menus, procurement, and participation records, the local wellness policy, including content provisions, leadership, public involvement, and communication, is reviewed. The Admin Review Audit Team has a wellness policy review checklist to use as a guide, and we link it to our website so district staff can be well prepared for the local wellness policy portion of the administrative review. This checklist identifies the evidence needed to demonstrate compliance with the requirements. So I hope this information and these resources will be useful for completing the local wellness policy assessments and learning more about their use. Please do not hesitate to contact me with any questions or for any assistance. As you work on these, again, the triennial review once every 3 years. But before we end, I do want to highlight two final things. On the home page of our website, there's a sign up for a monthly e-newsletter, and you can register here to receive great source of resources, grant opportunities, and timely information from our state and national partners. It only goes out once a month, and again, you can sign up right here. And I also want to invite you to our annual Breakfast for School Wellness Leaders, which is on October 16th at the start of next school year. Instructions for reserving a district table, which we know many of our districts do, or purchasing individual tickets will be linked here on our homepage, and it will be included in our e-newsletter. So thank you for attending this training and for all of your support for health and wellness in your school community.
Thank you, Karin. Thank you. Like Karin said, the wellness policy is really a team effort, and all of the resources that she highlighted here are going to be very valuable in helping you assess your wellness policy and making sure that you are maintaining compliance with that. If anybody had any questions, I don't know, Caitlin, if anybody's put any questions in the Q&A.
Yes, we have one question asking if the registrants will get a copy of the presentation when they get a copy of the recording of the slides.
Oh, that's a good question. I think, can we do that, Karin? Can we provide a copy of the presentation along with the recording?
Absolutely. And we can also link that on our website. I know, Jen, you said you'll be sending that out from RIDE to everyone who registered, and we can make that available as well.
Okay, thank you.
And that was the only question so far.
Okay, so we'll just give people a minute or two. Sometimes it can take a minute to type a question. You can also feel free, if you'd prefer not to type your question in the Q&A, you can always reach out to us with emails also and ask questions that way, or even a good old-fashioned phone call. I'm here for that too.
Oh, wait, another question?
All right.
Oh, someone said no questions, but thank you for a beautiful presentation. The resources are laid out so well. Thank you, Bethany.
Thank you.
Well, we hope they'll be helpful. They are designed, and again, the video tutorial can be helpful, but really the way we do things, right, at Rhode Island Healthy Schools and at RIDE, we're here to provide whatever assistance that you need. So please just reach out. We have our emails here, and when it gets sent out, I know, Jen, you can share mine again, but I hope that you use our website for all of the resources that it has. I can see, do you see there's a hand raised?
Yeah, I'm gonna allow Margaret to go on mic.
Okay.
All right, perfect, Margaret.
Hello, can you hear me?
Yep.
Hi, sorry, I tried to put my question in the chat and it didn't, it wouldn't post. So I was wondering if there's, I spent just a little time looking through your website. Is there any that we can find publicly available data about different district assessments or federal reporting or statewide reporting that you were talking about, the triennial reports? Are those available in any specific place?
So Rhode Island Healthy Schools would not have that information. A particular district, or I don't know, Jen, if RIDE or if that is public information.
Yeah, we're not maintaining that here at RIDE, but again, the assessments are meant to be available to the public. So I don't know if, or I guess maybe it's the results of the assessments that would be meant to be public. But I don't know if on individual district websites, if you might be able to find more information there.
That's what I was assuming that's where I would look, but I wanted to see if there was any central place because I think it would be useful to.
Sure.
They're meant to be public, is to see them publicly.
And that's a really good point, and maybe something to think about in the future.
Thank you so much. This is really helpful.
Sure.
We also had a question. Can you attach the review documents in the email with the presentation? And so I think it's that assessment tool checklist that you were going over, Karin. But I think that's available on a link on your site, correct? And that's
Yeah, I think it's probably best to go, and Jen can do that, to provide the link to the page, that monitor and assess page, because it will have both the single school as well as the companion district summary with the tutorial video right there. So if you were to land on that page, I think you'd get kind of a better picture and understanding of how to use them than to just have a link right to the spreadsheet.
Sure, I can definitely include that when I send the email.
And thank you both so much. We had a question. What are some of the challenges that districts have run into when trying to do these assessments?
I don't know if Karin, I feel like you probably have a lot of anecdotal.
Yeah. I would say number one, and the reason why we're doing this is the requirement around the triennial assessment, which is what we're talking about, is that, and it includes the public reporting and assessing the implementation. So most districts in Rhode Island, I have to say, I think we do very well with complying with this. We have that state law about the wellness committees, and that is terrific because that's a regular group that is meeting and reviewing this and revising policy. And so I think most districts and charter schools are doing pretty good and have focused on that policy work. But it's more than just having a policy that you can say, check, we've got that. It's about how is that policy living every day in your schools? And that's where the assessment of the implementation. And I'd say it was, COVID, like everything in schools, kind of challenged things with the child nutrition program office, and the administrative reviews weren't being done. So really, we're just getting back now and making sure that districts understand that responsibility and then again have the resources to do it. So I would say the challenges, have been that that it hadn't been a priority, that they didn't have a review scheduled. So I think more likely districts are looking at that when they do have a review and they know that they must prepare for it. So that's why we wanted to offer this so that people are aware of what what's required. And I'd say it does require that each individual school, as I said, it's really the only effective way is looking at what's happening in your district. Some districts, if there's only, one school or it's a charter school, but if you look at our larger districts, things can really be different from school to school, like an elementary on one side of town and another. And so what you really want to do is be able to find out from those folks at that school how they're complying. And then really it's about what are you doing well, what's working well, and then what areas do you need some support or do you need better communication? And then how the wellness committee can do that. So I think those are some of the challenges, kind of getting everyone on board. And like everything, finding the right time of year to do it, because we know that schools, it's a short school year. I think here we are again saying, another year has gone by. So it's tough to put it in, but that's where I think that a wellness committee can really take a look at the calendar and say, when's the best time for us to do this?
Thank you, Karin. We have another question. How do you, if there's a school or that doesn't have their wellness policy listed on your site and they want to add it, how do they get that to you?
Excellent. I love that. I was going to mention it and forgot. We would love to include it. So if you have my email, you can send it directly to me, or when Jen sends up the follow-up email, she'll provide that. But absolutely, we'd love to include it.
Okay, I think that's the last of the questions, unless anybody has any last call ones. Margaret, your hand's still raised, but that might be from before.
So sorry, that was from before.
Well, that's fine. I know there's a lot of buttons on this. That's perfect. Thank you. And let me just see. I'm going to reply to one thing. And they're loading. Oh, okay. Someone asked, can you tell me where they find a schedule of when reviews are being done?
Yes. So, yep, no problem. We don't post a schedule of when we're doing reviews, mostly, well, there's a couple of reasons, but mostly because the review schedule is always tentative for us. There are reasons that it can change and we might have to move things around. So there is no, if you want to reach out to me individually in an email and ask me when your review might be coming up, I would be happy to answer that question for you and tell you tentatively when your next review is scheduled for.
And would you say, Jen, that the food service provider would be a key person, because much of the other review or much of the other content that is being reviewed has to do with the school meal program. So the wellness policy portion of it shouldn't just be the responsibility of the food service, but that person may know about when it's coming. Would you say that's true? Or the business office? So I know we probably have members of wellness committees, or which could be principals, could be school committee members. So they may not be one of the first to know about it.
Yeah, that's a good point, Karin. So here in our office at RIDE, we share most of our information with, for most schools, it's the business manager. They might have another program contact, and most of the districts have a food service management company. So whoever their food service director is, those are the folks that get the majority of our emails. There, like Karin said, there were a lot of people invited to this webinar who are not part of that particular group that receives emails directly from us about compliance and maintaining the program, because there are a lot of other pieces to it besides the wellness policy. So certainly those are the people at your school that you might want to partner with to make sure, you know, if you're looking for some type of regular communication about these items, then those might be the people that you want to connect with.
I think that was the last question.
Okay, great. Thank you so much. Thank you everyone for coming. Again, please feel free to reach out to us by email at any time, and we will try to get all of this information out to you as quickly as possible. The recording, the PowerPoint, links to websites, and all of that as soon as possible. So thank you. And thank you, Karin, and thank you, Caitlin.
Yeah, thanks to you.
Thank you. Thank you, everybody.
Okay. Have a good afternoon.